the directions so that you can pass your NCLEX exams without difficulty. We believe that doing so would give you the needed support to be able to pass the NCLEX exams. So in this discussion, we are going to look at the key directions that is required of you if you take the decision to write the NCLEX exams. Before I start, how many of you have had the opportunity to try the NCLEX exams, if I may ask? Has anyone attempted to write the nclex exams?
No, sir.
Okay. Has anyone tried the nclex exams?
No, sir.
Okay. Very well. Okay, so what is the purpose of this discussion? Like I said, we set up this as a team. It's a team of people in Ghana and then outside Ghana who thought that a lot of people need assistance to be able to even initiate the process of writing an NCLEX exams or any foreign exams for that matter. Whether it is a CBT exams where you can use it to go to UK, or the NCLEX exams where you can use that one to go to the United States of America or Australia or Canada or New Zealand. You need to get some support, some guidance that will be able to direct you to be able to know what exactly to do. And if you have the necessary support and directions, you will be able to pass the exams. Nursing speaks a universal language. So whatever happens within a particular jurisdiction about peptic ulcer disease management or liver cirrhosis management or head injury management is going to be the same thing if you go to any of the countries I've mentioned. And that is why you will find out that many of those countries are coming to Africa to pick the nurses, because they believe that nursing is a universal profession, and that whatever knowledge that you have acquired, you can actually, use that within their jurisdiction as well. So we then said that, well, let's come out with some step-by-step strategies to help people to be able to go through this particular exams. And that is why we have set up this this whole support system, so that we can also provide career guidance. Sometimes the young nurses even finish the nursing colleges or the universities, and they don't know the direction to move. There are people who have finished the nursing colleges for the past 3-4 years, and they have not been employed. They are sitting down. They do not know about some of these opportunities that are out there that they can actually build on and then start their life all over. So we are also offering this as a form of mentorship, so to speak, to assist the new crop of nurses wherever you want to find yourself in the world, so that you can actually, go through this process. Now, there are so many nursing licensing exams all over the world. And like I said, whatever the jurisdiction is, they want you to see whether you can demonstrate the knowledge, the skills, and the competence that you have acquired as a nurse or a midwife throughout your training. And in doing so, they even want to gauge or measure your safety and how effective you are. And I always tell my students that the licensing exams are usually interested in finding out, or is set up to actually find out whether you, the registered nurse, or you, the nurse or the midwife, you know what can kill a patient. So most of the time, the questions they'll be asking you are routine activities. But before even the routine activity, they are going to ask you spot-on questions that can kill a patient. So if you are not able to answer those questions, they know that you are not safe for practice. All right. If you don't know that, if you are to give aminophylline to a patient and you don't dilute it and give it slowly, and you are to break the ampoule, draw all the drug into the syringe, and you just push it rapidly into the patient, if you don't know that that can kill the patient in a matter of minutes, then you are not qualified to be allowed to practice as a registered nurse or a midwife. So there are certain things that we ought to know as far as the profession is concerned that anybody else on the street or in any other profession cannot know it, or that do not know it. And in fact, there are certain peculiar things that a nurse should do that many doctors don't have an idea about it. And that is a distinction. That is where the line is drawn. And so they will ask you those questions to see whether you are actually, ready to practice. And therefore, when they are certified, then they will give you the license. So what are the services that we render at Nurse Scientist RN? We offer several, services, and at different or separate fees. So credentialing is one of the support services we can help you, which means that you have to go through a process of verifying your academic details and then your license. So I must say that before you can write an NCLEX exams, you must have your license. Okay, you must have your license from the jurisdiction. So if you are moving from the United Kingdom to Australia or Canada or the US, you need to have your license from that place. The same apply to Ghana. If you are moving from Ghana to any of those countries, you must have the license from Ghana. And just that we have two main types of NCLEX exams. We have the nclex RN, which is for registered nurses, and we have the nclex LPN, okay, which is for the NAC. So you can equally use that one to sit for the NCLEX, but it's for a low-level licensed practical nurse. When you get there, you'll be practicing just like an enrolled nurse is practicing here with the registered nurses. So they are two different things. So when I say license, the license does not necessarily have to be the RGN or RM in our case. It can be any of them, and you are still eligible to do that. So there are companies that helps you to evaluate your credentials